Asalaamu Alaikum. Good afternoon to one and all. Today in this video I will be having a brief discussion about one of the most commonest disorders that arises from the skin, that is known as acne vulgaris. Okay, so what is acne vulgaris? What are the causes of acne vulgaris? What is the pathophysiology? What are the types? What are the diagnostic criteria? And what is the management? So these all the things I will be discussing throughout this class. Okay, so before I start this video, I have a small request. Please watch this video till the end so that you can get all the points clearly understood. Okay, so without wasting much time, let's go straight to the topic. Okay, so as we are going to define as we are going to discuss about the acne vulgaris, so first let me tell you what are the commonest areas that are mostly affected by this disorder. Okay, so these are areas, we can say facial areas, neck areas, then we can say back areas, whether it is upper back or lower back areas, and also the upper trunk, that is chest. Understand, that is chest area. So these are the areas which are most commonly affected by this disorder. Okay, so now next one, let's have a brief discussion about the sebaceous glands. Understanding, so sebaceous glands are mainly situated in the we can say dermis. Understanding, so sebaceous glands are situated in the mid dermis. Understanding, and what is the function of sebaceous glands? The function of sebaceous glands is to produce and secrete the sebum. Understanding, so they have to secrete and produce the sebum. Understanding, in order to make the skin to look healthy and good, and also in order to make the skin to become to remain lubricant, hydrated. Understanding, so this will be the, and also helping or also protecting your skin to get damaged because of the bacteria, yeah, because of the heat, this external, that's thermal radiation, external radiations, and all that things. Understanding, and also prevent the skin from developing some other scars and some other infections. Understanding, so this is the mainly the physiology of sebaceous glands. Okay, so next one is, let's see what is this one, acne, or what is acne vulgaris. First let's talk about the acne. Okay, so acne is nothing, it's a skin condition. Understanding, that occurs when the hair follicles, understanding, when the hair follicles, they are plugged means blocked or obstructed. Understanding, with oil, dead tissues or dead cells along with the bacteria. Understanding, so means that if you can see here, see, this is the pilosebaceous unit. What is pilosebaceous unit? Pilosebaceous unit means when the hair follicle is growing, it will be growing along with the sebaceous glands. Most of the sebaceous glands will be growing along with the hair follicles. Okay, that you have to understand, that you have to remember. Okay, so what happens mainly when this is the sebaceous gland, this is the sebaceous gland, when there is the obstruction, when there is the overproduction of the sebum, जब sebum जो होता है ना, जब वो बहुत ज़्यादा रिलीज होता है, तो उसकी वजह से क्या होता है, तो उसकी वजह से जब वो ज़्यादा रिलीज होता है, so that will be taken, that will be blocking the opening of the hair, we can say hair canals, yeah, hair follicle canals. This one is the canal. Okay, so when there is overproduction, so this sebum, it will be lying in the opening, or we can say area, yeah, canal of the hair, so it will make it big, it will make it क्या करेगा, block करेगा, and also because of oil, or we can say dead cell. Why we can say oil? Because there is the oil means sebum only. Understanding, so that means increased sebum. When there is an increased sebum, so this will be blocking the canal, that is follicular canal, and also there is the development, yeah, there is a growth of the bacteria that may also results in the blockage of this canal, and then that will be forming the pimples, so that is known as acne. Understand? Okay, so next one is acne vulgaris. What is acne vulgaris? See, acne vulgaris is a common follicular disorder that will be affecting the susceptible means where the production of the sebum is more, where there is the abnormal hormones levels. Okay, when there is the high cholesterol levels, or we can say when there is the alteration in the cholesterol levels. Understanding, or we can say oil production, yeah, we can say bacteria are more growing, so that it is, that is now what is known as susceptible. Understand, it could be on the face, it could be on the upper chest, it could be on the neck also, and sometimes it could be on the back also. So that is acne vulgaris. Okay, now let's talk about the incidence, or we can say this one, prevalence of this condition. Okay, so this acne vulgaris mostly common okay, most commonly occurs in the teenagers as well as early adults. Okay, so as we can talk, if we will talk about the age group, the age group ranging from 12 to 35 years, they are mostly commonly affected by this disease, okay, say disorder. Okay, next one is both the genders, okay, both female and male and affected equally, yani equally affected hota hai male or female, lekin but in the females this will be occurring slightly on the onset, will be slightly this one early only. तो जो फीमेल्स में होता है ना, फीमेल्स से जल्दी आता है, यानी प्यूबर, जब फीमेल्स प्यूबर्टी की एज पूछता है तो एज कम्पेयर टू द मेल्स, उनमें सबसे पहले उनमें एक्ने डेवलप होता है, तो उसके बाद बॉयज में होता है. तो मीन्स दैट कि देयर इज द अर्ली ऑनसेट इन गर्ल्स and there is the later onset in the, yeah, we can say the boys can develop this later on, understanding, in the puberty age. Now next one is the etiology. What could be the causes of this acne vulgaris? The first predominant cause, it would be that is genetic. If there is any genetic cause, means that if your father and mother they are having, understanding, yeah, if there is any genetic malformation, yeah, abnormal gene productions, abnormal gene formation, this may lead to the development of the acne. Okay, next one, hormonal changes. Hormonal changes including, for example, androgens. When there is the hypersecretion of the androgen, when there is the hypersecretion means when there is the much more production of the androgen hormones. जब androgen hormones ज़्यादा बनता है ना, so they will be stimulating, understanding, they will be stimulating the sebaceous gland to for the hypersecretion and hyperproliferation of the sebum. Okay, that will lead to the acne, or that will lead to the formation of these pimples. Okay, understanding. Next one is the bacterial factors. As I already told you, if there is the bacteria may also develop, yeah, we can say cause this pimple formation. Then family history of, if there is in your family they are having, so you may have developed that acne vulgaris, understanding. And stress may also cause this one overproduction of the androgens hormones, we can say overproduction of sebum. And next one is the poor diet. When you are not having a balanced diet, this may also become the risk factor. Okay, and last one is hyperkeratosis. What is hyper means high, keratosis means formation of the keratins, that is proteins. Okay, keratin is a protein, understanding, in your skin. Okay, that will be produced, that will be secreted or produced by the stratified, understanding, stratified epithelium. Now next one is about types of acne. Okay, so in this the first one is nodules. Okay, what is nodules? Nodules are the inflammatory pimples. Okay, so they are inflammatory and painful pimples. Okay, and we can say they will be appearing on the skin surface, or they are red inflammatory pimples that will be appearing on the skin surface, understanding. Next one is the pustules. What is pustules? Pustules का मतलब ये होता है there will be some this one pimples, understanding, in under that pimple, yeah, on the tips of these pimples there is the presence of the white discharge, that is known as pus. Okay, now next one is about the blackheads. What are blackheads and whiteheads? See, blackheads are the bumpus, we can say these we can say pimples that will be formed on the surface of skin, and that will have the exposure with the air. When there is the exposure of these pimples with the air, the surface of these bumpus or these pimples will be blackened. Okay, and next one is the white patch. What is the whiteheads? Whiteheads are the closed pimples. Closed pimples means when they don't have the contact with the air or exposure, so that's why the surface remains unchanged. Okay, the color remains unchanged, that's why we can see them as whiteheads. Okay, but there will be the formation of the pus, there will be the pus that will be filled inside the pimples. Now next one is about the papules. What are papules? See, there are many differences. We can see there is pustules and papules. Pustules are the red tender bumpus with the white pus on tips. Papules are red tender bumpus, but they don't have the pus on the tips of their pimples. Okay, so the pimples, the tip of the pimples, they are not filled with the pus. Okay, so that is the difference between pustules and papules. The last one is cystus. Cystus means fluid filled cells. So the cells which are filled, okay, the pimples which are formed, understood, which are produced on the skin surface. So inside the pimples there are some cystus, there are some fluid filled cells. Okay, so this is all about the types of the acne, or we can say acne vulgaris. Okay, now next one is about the pathophysiology. Pathophysiology means disease cycle, how we can say how this disorder often occurs. Okay, so the first one is due to etiology. Etiology means hormonal change, understanding. So hormonal change, for example, we can say androgens. When there is the hyper secretion of the androgen hormone, जब androgen hormone बहुत ज़्यादा secrete हो रहा है, this androgen hormone, this may stimulate, understanding. So this may stimulate the this one sebaceous gland to secrete the sebum. That will be the hyper proliferation, we can say hyper secretion of the sebum, and also the enlargement of the sebaceous gland. See, मैंने पहले ही बोला कि वो जो gland जो hair follicle canal है ये कैसे block हो जाएगा? Why? Because there is enlargement. So when there is the enlargement, this sebaceous gland and this sebum, it may be filled or it may be enter into the canal and it will be blocking. That we can see there is a hypersecretion as well as there is the enlargement of the sebaceous gland. So here when there is the enlargement of the sebaceous gland, this may lead to the increased production of sebum. When there is the increased production of sebum, this increased production of sebum will be collected in the canal of the hair follicle. That will be blocking. That is known as clogging. Okay, so we can see blockage of the opening of the sebaceous glands, and that will lead to the promotion of growth of bacteria, and lastly it would be developing or resulting in the formation of the red bumps, yeah, we can say the pimples, or we can say acne. So this is all about the pathophysiology of acne vulgaris. Okay, so the next one is about the clinical features. Okay, what are the clinical features of this acne vulgaris? Okay, so there will be whiteheads, that's closed comedones. What is closed comedones? Comedones का मतलब होता है when there is a deposition, or we can say when is the collection of lipids, yeah, we can say sebum, yeah, we can say infections, yeah, we can say bacteria inside the canal, that is follicular canal, that is mainly known as comedones. Okay, so that is closed comedones. Okay, so next one is the blackheads. So there will be the open comedones. Understanding? So these whiteheads, these blackheads, they will be exposure. That's why there is known as opener. So they will be surfacing, or they will be just growing on the skin surface. That's why we can call them as the open comedones. Okay. Next one is the papules. Okay, this is papules. And then cystus means fluid-filled sacs will be there. Nodules, that is painful pimples, will be there. Okay, there we can say also the inflammation. We can say folliculitis. Inflammation means erythema. When there is the much more production of the blood supply at that area, there will be the heat production also. So there will be swelling of these follicles, that we can see here. We can say folliculitis also. Then erythema, I already told seborrhea. Erythema means when there is the much more migration of the WBCs, that's white blood cells, to that area, and yeah, we can say RBCs to that area only. Okay, so we shall make that area red. Then last one is lesions. Okay, lesions means the pores will be formed, okay, through the pores only, so these pimples will be arising. Now next one is about the diagnosis, how to diagnose these pimples, how we are going to diagnose these acne. The first one is about history collection. You are going to ask the history. You can get the family history, you can get the any history of this acne vulgaris. Yeah, you can get also if there is any genetic factor, if their parents were having this condition, they may have spread to the they may have genetically, yeah, we can say embryonically, they may have spread to the baby, yeah, we can say this one developing embryo, so that may have caused. Okay, next one is about the biopsy. Biopsy means it will be simply taking of the sample, that is skin sample, yeah, tissue. Okay, that will be taken for the examination. Okay, so what is the actual cause of this acne vulgaris? The next one is the complete hemogram, but the blood test will be done, because in the blood test there will be the determination of the lipid levels, yeah, we can say cholesterol levels. Understanding? So cholesterol levels will be checked. What is LDL, what is HDL, what is VLDL. Understanding what is the level of cholesterol in the blood, that will be also checked. If there is a hypercholesterolemia, if the high cholesterol, this may also give rise to the formation of much more sebum. Okay, the next one is the lipid profile test, we can say lipid enzyme test, and last one is the management. See, the management will be of two types, that is pharmacological, non-pharmacological, and three types, and then surgical management. First of all, we have to manage the symptoms by taking by avoiding the cosmetics. Understanding, we have to avoid the cosmetics which may contain the irritants, or the irritants which may contain irritants. We also should not consume the food, understanding, that is having the high fat levels, that is having the high fat. Understanding, we should not also consume the dietary product like milk, yeah, we can say chocolates, yeah, we can say processed foods, yeah, we can say red meats. Okay, these are the foods we should control first. Smoking, alcoholism, this all should be avoided, and then thereafter we can go for the pharmacological therapy. Like for example, that is we can go for the topical antibacterial therapy. So that is benzoyl peroxide. These benzoyl peroxide is a most abundant therapy. Okay, I can say most abundant this one topical antibacterial, the antibacterial agent, which will be helping in reducing the inflammation, reducing the pain, reducing the formation of the comedones. Yeah, we can say the formation, the collection of this sebum. Yeah, we can say oil production. So that will be helping. Understanding. The next one is the vitamin A acid. Okay, so that is vitamin A acid compounds that will be taking through the oral. So these are the oral tablets will be taken. Understanding, which will be reducing the collagen by inhibition the keratinocytes. If the cause is keratinocytes, if there is the keratinosis, okay, means that there is a formation of much more keratinocytes, so they will be collecting inside the canal. So the drugs will be given in order to inhibit the production of much more keratinocytes. Okay. Then next one is the topical antiseptics. So antiseptics we can also give in order to remove the bacterial growth. Antibiotic also we can give in order to relieve that. Creams we are going to use, gels we are going to use in order to apply so that these symptoms will be reduced. Okay. The next one is about the hormone therapy. That is before that is oral antibiotic, that is tetracycline, doxycycline. Okay, they will be used in order to relieve the symptoms. And the next one is the hormone therapy. Hormone therapy में हम कहेंगे progesterone estrogen therapy. When we are giving the progesterone estrogen therapy, this therapy will be suppressing the sebaceous glands. ये sebaceous glands को suppress करेगा, जिसके चलते as a result the sebaceous gland will not be able to consume, which will not be able to produce the much more sebum. Okay, so there is the little sebum will be produced, and the normal levels of the sebum, the normal function of the skin will be promoted. Okay, the last one is about surgical management. In the sea, when you are unable to treat the symptoms with the medical treatment, or we can say avoiding the avoiding the foods, avoiding the chocolates, avoiding the dietary products, so there is only one alternative method, that is surgical management. That is removing these abrasions, removing these skin lesions, removing these pimples, collagen pimples, we can say comedones, by using the different types of the method. Okay, first one is the removal of the comedones. Okay, so comedones means collagen, when there is the blockage of this hair follicles. Okay, so when there is a blockage of the hair follicles, so that area should be excised, that area should be removed. Okay, then extractions of the pimples. If there is pimples are not going, so you can go for the construction. So there is a destruction. Yeah, we can say reconstruction. So that is going to, that means, okay. So for next one is about the extraction of pimples, that is the removing of the pimples. Understanding, which may not be treated by the medical treatment. Next one is the laser resurfacing of scars. If there is a formation of the scary tissue, that is hard tissues, hard pimples. Understanding, so we can say tender pimples, so that are hard to remove, they are not able to remove because of the medical treatment, that should be removed by using the laser surfacing therapies. Okay, the next one is the dermabrasion for the scars. Also, when we are cutting off the peeling of the scar tissues. And last one is the removal of the pustules and nodules. So this was all about the surgical management of the acne vulgaris. Okay, so this was all about today's class. I hope you have understood. Okay, so with this I'm going to conclude this topic. It's Allah Hafiz. Asalaamu Alaikum.